help support George in his efforts now. And this, the Organ Transfer step-by-step program. And to the media, also to thank you for coming out this afternoon. And he's all yours now. Any questions yet?
Yeah. Outside of driver's licenses, where can you put your thing in for donors?
Okay, first of all,
I know is driver's license.
yeah,
Where else can you?
here's one of the problems that you know we've faced in the last 20 years. It's no longer on your driver's license. It's on your health card. It was on your health card in April of 2000. And when a change like that is made, it should be announced so that every person knows about it. Like, I've had just thousands of people that don't know that it's changed to the health card. You know,
Right.
This is another problem of our lack of awareness, lack of education, and it should, you know, we shouldn't have to have people searching for or not knowing which card it's on or where to get a card. These things should be available. You can also get donor cards at the hospital. I think there's one local group. I'm not sure if there's a kidney foundation chapter here in this town.
Oh yeah,
Is there?
we have a chapter for it.
Okay. So I think they have an abundant supply of donor cards also. So these are different places that, and the idea of the card is to sign it and then keep it on your person, and that's the idea with why they have it first on your driver's license. While he's on that question, because this is something that we've been really trying to, and passionately trying to address, we're still holding on to a very prehistoric system in our country, and that is the one that we have to depend on the family to make the final decision. Now, it is not the family's fault when they say don't touch the body, even after the individual has consented to donate his organs. We're approaching the family at a time of shock and at a bad time and at the weakest time. And we're approaching him during a time when 6 lives are dependent on it. And there's too many organs that have gone underground that could have been used because we're still using that system. And there's too many families right now that are living with a lot of regret. I've talked to a lot of them that wish they weren't asked at that moment, because they would have said yes any other time, So what we're trying to do is reach all 3 levels of government, the municipality government, the provincial government, and the federal government, into understanding this and making a change. Because most of the other countries that are doing well in their rate of organ donations use a good system. And that system is that they put the focus on the decision outside of the hospital. The decision should be made outside of the hospital when the individual is in the right state of mind and body. And it should be given the same emphasis and importance as a will or any other legal binding document. And we should try and have our country and our people and Canadians understand the importance of organ donations and have the idea of becoming an organ donor as important as voting, as important as driving, as important as getting married. We as individuals could do a lot of good. And that's very powerful, knowing that you have the ability of saving 6 people's lives. I don't think that's really hit home in our country yet. Other countries have embraced that idea. Other countries have supported it, and they've gotten all their governments involved with it, all their big corporations. And Spain, for example, Spaniards are, you can talk to any Spaniard about organ donations, and they'll tell you that, yeah, they made that decision. And here's the other thing with our prehistoric system right now. We are robbing the individual of making that contribution too, right? And that's the other thing that upsets me why we're still holding on to this system, because while we're here on this earth, we want to do everything we can while we're alive. And one of the things are, yeah, I want to, when I pass away, I want to possibly save 6 people's lives. Why should that be robbed from me, you know? And it's not your family that's robbed, it's the system, you know? We're approaching the family at the worst time possible. So we're trying to do everything we can to encourage all levels of government to encourage create a registry and have our wishes legal binding. And we will focus on not having one more organ going underground that could have been used and a life could have been saved.
Thank you. You've got your answer now?
Yes, outside of, you say it's not binding. If I sign that over, my kids can block it. Is that what you're saying today?
Your immediate family can, yes,
That's
because
not
they're
right.
going
I
to.
see your point now,
They're going
right.
to get approached
Right.
at a very difficult time, at a weak time.
Right, which
So
shouldn't
we're-
be.
At this time, we're encouraging people to discuss their wish with their family at this point. But what we want to create is to have it as less dependent as
Right.
possible on that family making that decision.
Thank you.
Are there any further questions?
Why do we have so much lack of communication with this, we're all saying for story?
Well, once again, you know, we have small organizations that are doing their part, but it's always focused on the converted. We haven't gone outside of the hospitals. We haven't gone, you know, into with celebrities to get involved with this, you know, and we need to. You know, we need to bring this, and you know, we do need our government
Yes.
to take a real stand here. They can't ignore this any longer, you know. Our life has got to be the most important thing. So why do we have the lowest rate in the world, you know, and it's not a reflection on Canadians. It's a reflection of our government not doing what they're supposed to be doing in this area. And they need to really take a stand and start doing something about it.
I'm just wondering, politically, do you think part of this process is the fact that the healthcare funding seems in such a crisis right now? Do you think that possibly that the governments could fear the fact that if we have more organ donations, there would be more organ transplants, and therefore far more stress on the medical system and the costs therein? And at this point, they seem to have, we're looking at, every time we look at the healthcare situation the way it is now, and the fact that they're saying, well, we put everything we can into it. Clearly, I think your point is very clear, and you are, and I quote, living proof of the issue. Someone donated that, that's why you're alive and with us today, to spread your message. And I think the fact that as the program and your message gets out further and further across the country, and hopefully it will, but the fact is that in terms of medical dollars that it's going to take to perform the numerous operations that it would take, it maintains lives, but the dollars to do that would be staggering. And I wonder if indeed at the political level, if governments possibly fear that cost of the rising cost of healthcare to provide a country-wide increased transplant program.
They've shown a lot of results in countries that have increased their rate over the years, as opposed to money that they were spending on patients on dialysis machines and, you know, all sorts of other hospitalization costs. And they're saving a heck of a lot of money with transplants. There's just definite proof that economically we're better off if we could initiate this wide campaign from coast to coast. You know, at this point, I think it just, the government just hasn't accepted that we have a cure in our hands.